started in just a minute. You'll see that we're mixing it up a little bit this morning and going forward. This is Heike Johns, and normally it's my name that you see on the screen, but Kat has graciously offered up to be our official behind-the-scenes magician. So going forward, you will see that it will be her name that will show up on the screen, and any registration communication will come from her. So don't be surprised when you see that going forward. You are still in the right spot. So quick reminder, as I usually do, if you have questions, something that you want to share, please do not send that to the host. Please send that to all panelists so that we can make sure the right folks see that question and we can address that. And with that, I am going to turn it over to Jess.
Hey, good morning, everyone, and happy Friday. Thanks for joining us for the monthly call. I have a few updates to share with you today, and just so we can avoid any rumors, I did message Heike and confirm that I could attend this call. I used talk to text, as most of us do, and talk to text told her that I would be on the alcohol. So not on the alcohol, I'm on the all call. Some updates regarding budget first. The department did submit the FY24 budget request, and that's posted online. In that, you will see some supplemental request items. You'll see department-wide contract staff for the remainder of this year, and that is really something we've talked quite a bit about publicly in terms of the department in its direct care facilities, both on the state psychiatric hospital side and the DD Hab Center side, are experiencing staffing shortages much to the same degree as our community providers, and so we are utilizing contracted staff to fill those holes, and so there will be a supplemental request for that, as well as an overtime request. Right now, and that always looks a little different if you're in that budget request and looking at it. It's usually submitted as a $1 overtime request, and that's because it's nearly impossible, probably just literally impossible, to project what overtime will be when you're putting that information together in September to know where you're going to be at the end of June. So that will have an estimate in it that keeps being updated as we get further and further into the year. There is $3.4 million general revenue for this year's supplemental request for the DD Provider Relief Fund transfer, and this is the HHS Provider Relief Fund that came down with CARES Act funding, and it was available to direct care providers, and so the division did receive that funding for our state-operated waiver sites, and it was just put into the wrong fund within the budget. So the division doesn't have the actual ability to spend from that fund. So this is a transfer of that funding to a fund where we can pull from. Little technicality there that may throw people off to think that, you know, we need $3.4 million. It's just moving the authority to the right place. And the other thing is that there is some moving expenses for $89,000, a small amount, but it's part of a really large effort, and that is our effort of reconceptualization and making sure that DMH is operating in a way that we are meeting the gaps in the highest needs in the state. And right now we know that we have individuals who are on the behavioral health side backed up in jail settings, a long waiting list in terms of being able to receive care and treatment in a state psychiatric hospital. And then in the DD universe, we have a large number of individuals who are boarding in hospitals, also children boarding in hospitals. And so this is all part of, that small piece is part of our much larger efforts to utilize space and staffing throughout the state at some of our state habilitation centers and state-operated sites to ensure that we can, when we have the ability to hire staff, take those in crisis within the community, boarding at the hospitals, maybe temporarily provide care for those who have received treatment, no longer require care in a state psychiatric hospital, for all of those individuals, not on a long-term basis, but as long as needed to ensure that a community provider is available to serve them. So that is in the supplemental. In the new decision item request portion of the FY24 budget, and this is just department request at this time, we have quite a few things. We have our utilization increase, which is both the number of individuals coming into services based on kind of who's been coming in recently, our projected increase in the growth of the number of slots needed for our waivers. So on the in-home side, it's an anticipated growth of 1,140 individuals. So that would be for the 3 non-comp waivers, and 445 for the comprehensive waiver, anticipated to come in FY24 at this point based on the data that we have. And then that is also increases in care plans for individuals who are currently within the waivers. We break those two things out now. So total for the DD utilization would be $117.4 million as a new decision item request. And then we have several GR pickup items, and they are all related back to the use of the HCBS Enhanced FMAP funds. So those funds were one-time funds that the state earned, and they were appropriated in order to make sure we were using that funding while it was able to be spent in a way that was able to be spent, had to be used to enhance and expand HCBS in states. And so we have a GR pickup to get the ongoing funding for all of those one-time funding sources. So all of these items were intended to be ongoing, and they were just using that one-time funding to make sure that it was spent and exhausted before the general revenue pickup came in. So that would be rate standardization for HCBS in total of $264 million, the value-based payment of $60 million, and HCBS enhancements for $14.3 million. Those would all be the GR pickup. And then not included in the department request that some people may be wondering about is two different things that we've been talking about that we're still gathering information on finalizing numbers. So those two things are the rate study refresh. We anticipate a finalized rate study in December, and the DD Health Home, and we anticipate having finalized drafts of that ready in November. So more to come on those. Other updates, we did get our Appendix K approval. What that means in layman's terms is that we can pay the rates back to the date that they were actually approved. So we had our approval for the waiver amendment, which allowed the rates to be increased as of October 1st. And for those that changed methodology and in the large amount of increased funding that came in during the last legislative session. And that meant that providers could start billing at the new rate effective October 1st. But we were really waiting on what we call an Appendix K authority to go back and pay providers the difference between the old rates and the new higher rate for July 1st through the end of September. So we do have approval to do that now and are in the process, and our teams are in communication with providers about that. The value-based payment waiver amendment is still moving along, and we actually have our 15-day call with CMS. That was submitted about 15 days ago, because we have our 15-day call, which is to check in to make sure there's nothing big that CMS sees as a major issue, but we did have an informal review prior, so we don't expect that to be anything major, but we have that this week, so we should know more then. We are also working through the Partnership for Hope and the Missouri Children with Developmental Disabilities waiver renewals. Those will be in FY24, and so lots of stuff going on in the waiver world. The value-based payment website has been updated with quite a bit of information, and it will be probably in the next 2 weeks updated with quite a bit more. We're working on the reporting systems and also kind of an easy chart that breaks down all of the value-based payment incentives into kind of a one-pager, so people can get an overview of the value-based payment system and what might apply to them, broken out by provider type eligible for each payment. And so within that, though, we also have that project. We will have reporting platforms through REDCap, so very similar to the provider notice, provider communication portal that came out, very easy web form. We anticipate we have drafts, and so we'll have provider testing periods, and that we expect our value-based payment ad hoc committee to probably start testing in the middle of November in order to have those ready. The next, so the rate study refresh, the next stakeholder meeting, mark your calendars, is November 10th. And we need to make sure we get lots of good feedback on that one. And so if you have time, that is going to be recorded, but make sure you watch it kind of as soon as possible, because we'll be requesting feedback on that by November 30th. So we'll have incorporated feedback from the first stakeholder call, so incorporated feedback on the wages and ERE, and then we will have the, sorry for acronyms, employee-related expenses. And then this call will also have kind of a draft of the market data on administrative expenses. And so there'll be opportunity to provide feedback on both of those things until the end of November. So I know how busy everyone's schedule gets, and I know that it's kind of a quick turnaround to make sure that we get everything ready for the end of December. So our advice has been to kind of block off maybe some time after November 10th and before the end of the month to work on gathering that feedback from your provider agency. So I appreciate that. Other updates, make sure if you have not yet, we have a lot of great speakers coming to the Missouri Alliance for Dual Diagnosis Summit. That is free to attend. It is November 9th in Columbia. It's for most of the day, like a 9 to 3:30, and really have some great speakers. Dr. Constantino is coming back from Georgia, and he's going to be our keynote. And we have a lot of great information on for both our behavioral health providers and our DD providers and partners in how to best serve, communicate with, take care of, ensure the rights of all the individuals who have a dual diagnosis. So we're looking forward to that coming out. And with that, I will go ahead and turn it over to our next speaker, and wish all of you a happy Friday.
Good morning, everyone. This is Holly Reif with the UDAT team, and I'm very excited to announce our very first success story surrounding assistive technology, remote supports, or health assessment and coordination. So I'm proud to introduce Tammy Meyer, who is the parent of an individual who's currently using a medication administration system, which you guys know that's one of our newer technologies available through our DMHDD waivers. So Tammy, I'll let you unmute and and take it from here.
Thank you. I'm hoping everybody can hear me. My name is Tammy Mayer. I have an adult son, 27 years old, and he's pretty high functioning, but he can sometimes be forgetful. Our next stage in life is to get him to be more independent and possibly being able to stay in our home after my husband and I are gone. And so we're working with with Brenda Halastanis on everything that we can find and use that helps achieve that goal. And one of the areas where we struggled was medications. Matt would forget. We'd always have to remind him. We had those little pillbox dispensers where we'd sort through a week's worth of pills, AM and PM, or 2 weeks worth of pills, and we'd have to sit them on the counter for him. So I don't know if a lot of you know about the Hero medicine dispenser at the time when we went through the process. Even the person that was working with us through, I think it was ARC, or Brenda would have to tell me who it was through. They hadn't even heard of it. So I do have a video. I don't know if I can share it with you. I'm trying to figure out how to share screens here. The Hero medicine dispenser is electronic, and you can put up to 12 pills, 30 days supply each in this dispenser. And you have a Hero application on your phone, and you can load the types of medicines in there. And I really wish I knew how to share this screen. It says share. Is anybody there that could help me?
Yeah.
The share
Sorry for
button
interrupting,
is grayed
Tammy.
out. I'm sorry.
Oh, it's a great app. Okay, I think I can help you. Let me.
Because this is an amazing machine, and I want to make sure that if people haven't seen it, I have a 38-second video that shows you exactly how it works, and then I have a few screenshots of the application on the phone. I don't know if you have to. Oh, okay, great.
There you go.
Hold on, let me see if I can get to the screen that has it. Bear with me, I'm not real good at this. So, can you see the video?
I see the file, but it's not open yet.
Okay, hold on. I'm so sorry. And now I've disappeared. Holly, can you tell me how to get this back to a large screen?
So I can see your computer screen. Right now you're in a folder that says common issues, and I see you hovering over the video. I'm not sure if you can right click and play it from there.
Can you see the video now?
No, I still see the file. So if you've got two screens going, it's probably showing on your other screen.
Okay, you see screen one now.
Yes, and this is your Cisco WebEx screen.
Okay, now can you see the video?
I am looking at, we are looking at your Change Unlimited information. And if you want, you can send us the video or send me the video, and I can have Kat include it when this webinar is posted to our website too.
Okay. Well, the machine itself, you push a button. So if Matt's at home, the machine makes a chiming noise, and that reminds the participant to take the medicine. So they walk in and they press a dispenser button, and it spins around within the machine, and it dispenses either whatever dosage you've programmed into the application on your phone. So in the morning, he takes 6 medications, and it will dispense all 6 of those medications. And when it's done, he removes the pill bottle at the bottom, the little pill cup, and he takes those pills and sits it back in there. And then the machine programs it to dispense the next medication, which is like 6 o'clock at night. So he doesn't have to do anything. The machine reminds him. We have it programmed into the application, and it tells him, it tells us what medications he's taken, if he's taken his last dose, if the medication is running low in the machine, it tells you it's time to order it. And so it's just an awesome piece of machinery. And we have found success with him. He'll come home from work and see the red light flashing, and he'll say, oh, I need to take my meds, and he'll push the dispense button. And that's stuff he would never do before. We always had to get the pills out, put them in the cup for him to take, and then, make sure he took them. So on your application, it will show if the medicine was dispensed. It'll show if the medicine was skipped, because you can skip the medication if you're like if he's not home and he's at my daughter's house, we can skip the dose being dispensed. But you can tell if they dispensed it and if they removed the cup to take it. Now, you can't tell if they actually did it, but at that point in time, I think they probably would. Most adults probably would. So I also have photos that I took screenshots of the app to show you exactly what it shows you in there and how you can program it. So unfortunately, I'm sorry, I'm not good at this, and I wish I could share this with you. But is there anybody that, do you know the cost of the Hero? I think the machine itself is, Brenda would be able to answer this better, but I want to say the machine is $500 that would be on the high side. And then you have to pay a monthly subscription for the Hero application. But for us, this makes him more independent to be able to stay in a home with maybe some supports after we're gone. So, the cost to us, the machine itself is an original investment, and it was covered by one of the funds that he qualified for. So I'm not exactly sure of the full cost. Brenda Halistanis would be able to tell you that. But the little machine that we got that was just a pill dispenser with the little alarm on that was like $80, and it did nothing. So it is a little bit more expensive, but it is well worth it if that's your goal, to be able to keep track of somebody actually taking their medications, not having to sort them out every single day or every week. You can do a month at a time, which makes it easier for caregivers or supportive people coming in home. The other thing I've learned, which we haven't done yet, is you can order the prescriptions through Hero. They do work with pharmacies, and so the medicines can be delivered right to a home. And right now we're still picking them up from the pharmacy and putting them in the machine. We are not having them delivered to the home, but that probably is our next step that we'll finish with this process. So I don't know if that told you everything you wanted to know. Never spoke at something like this before, so if anybody has any questions.
Tammy, I'm so excited that you were able to join us. Medication administration equipment is new to us. It has always been available under our assistive technology service definition, which is underneath the 4 DMHDD waivers. So it's available in all 4 waivers. And I would just really encourage that if anyone has more questions about this type of technology and can see a need for it for their loved ones, to reach out to their support coordinator or the UDET team. So the UDET team is the Universal Design and Assistive Technology team, and we're really, really happy to help get this into more hands of the individuals we support so they too can have this level of independence and daily control over their lives.
You know, I would say that a lot of times the less expensive process, he was approved for the Hero machine and the agency sent us the less expensive $80 one. And I called him immediately and I said, this is not going to help us. This is just a glorified pill box like we have. And so they went back and go, oh, you were approved for the other one. And we did get the Hero machine. So, you know, if you have people and they're not sure what they got, have them call their support. We call Brenda all the time. You know, she's made Matt she's helped us make him independent. And, you know, our goal is to have him live in a home and have some supports. And, you know, we're in the process of that. And in the beginning, we thought he might have to live with somebody, but as he gets older, things change. And so technology like this is wonderful.
Well, thank you again so much for your time, Tammy. I really appreciate you sharing Matt's success with us, and we hope that it continues. And please reach out if you have any other questions or concerns, and please shoot me the video if you would like to include that in our upload.
Where should I send that?
So you can send that to Holly, HOLLY, .Reif, REIF as in Frank, F as in Frank, at dmh.mo.gov. You can also send it to Brenda and she can forward it my way.
Okay, because the video shows it all. When I looked onto the Hero website, I was going to try to just pull that up, but they don't actually show it dispensing. They're like, it's great, and you can get rid of all these bottles and all of these pill things, but they didn't actually show the video of how it works. So I'll go ahead and try to get that over to Brenda and to you then, and the snapshots of the application. And if you guys have any questions, Brenda knows how to get a hold of me.
Wonderful. Thank you so much for your time this morning.
Thank you. Bye-bye.
Bye.
Holly, there is a question in the chat for you.
Yes. Because assistive technology is based on provider choice, like all of our providers, an individual could have a different remote support provider than an assistive technology provider, as they are not linked as the same thing. Now, you could use the Hero device, like Tammy was talking about, in conjunction with other remote supports and have it all under one. But if you were using one remote support provider, but then decided you needed an iPad with an app on it, you could find a different technology provider for that. And I hope that makes sense. And I'll drop the UDAT email in the chat box if anyone has additional questions.
Perfect. So thank you both very much. That was very informative, very helpful. So someone did comment, you're right, Ruth, I did not read the question. Holly answered it, and in her answer, I think she got to the question, but the question was, can an individual have one provider for remote support and a different provider for assistive technology, other applications? And so she answered that, yes, that they could. So we'll stay on top of that a little bit tighter. And with that, that takes us to Leslie Bradley with the federal programs update.
Thanks, Heike. Hi, this is Leslie Bradley with the Federal Programs Unit. Good morning, everyone. I wanted to provide a few quick updates for you. And Heike, can you hear me okay?
Yes, we can hear you.
Okay, great. So just touched on a few of these, but I'll go into just a few more details, but I'll keep it brief. The Health Assessment Coordination Service and Rate Methodology Waiver Amendments were approved by CMS and effective 10/1 of 22. Also on 10/6 of 2022, CMS approved Missouri's request to amend the HCBS waivers with the Appendix K addendum. What this includes is that effective July 1, 2022, rate methodologies were updated to a fee schedule methodology for certain HCBS services, and effective for dates of service July 1, 2022 and after, a rate increase will be implemented for certain home and community-based services. The division posted a memo for distribution of the HCBS Enhanced Spend Plan rate increases, and I will drop that link in the chat. If you have any questions, please direct them to your local provider relations vendor service coordinator, and I can also drop that link in the chat for you as well. The DD waivers manual is in the process of being updated to include the health assessment coordination service as well as the rate methodology that was approved in the amendment changes. Federal Programs Unit is responding to MMAC auditing questions, and once the revisions are completed, then MoHealthNet administration is going to review and post for a public comment period, and I believe that we are in that phase at this time. The July 2023 waiver renewal applications have also been submitted for MoHealthNet review. And those were the updates I had, so I'm going to hand it off to Leslie DeGroat.
Thank you, Leslie Bradley. Appreciate it. I'm going to share my screen. Give me just a second to get it together here. Okay, I'm Leslie DeGroat, your division's clinical coordinator, and I have a few updates for you this fine Friday morning. Our HRST, or Missouri Health Risk Screening Tool project webpage, we have a few updates on it that I'm tickled about, and I hope you guys are too. We will drop the link to this page in chat. We kind of updated our logo here. And then, of course, there's always the overview ribbon that has the HRST process document. We have a HRST webinar question and answers document right here. And that's new. Information for individuals and families, and that does have 2 videos that one can watch to get learn a little bit more about the tool. These 3 ribbons down here are brand new. The Residential Service Provider Agency information. On September 12th, we did a webinar to give an overview and a lot of information related to how a residential provider agency, what that would look like for them to go ahead and start implementing HRST. So if you click on that recorded webinar link right there, you'll be able to watch it. There's also a document below called Detecting Health Risks that talks about the tool, and that's from the Intellectability Company, and it talks about the benefits and things of that nature. Below that is residential provider presentation slides. So if you like to take notes while you're watching a presentation, you can utilize that. And then, of course, the HRST webinar question and answer document. And those are questions and answers that were asked for each of these recorded webinars. There's the same that's geared toward support coordination information. So if you want to go ahead and onboard, you can and start rating people who are non-residential. Just don't hesitate actually to reach out to us, and we will refer you to these videos for a first step if you haven't already been able to watch. Right here is the Dehabilitation and Employment Service webinar that you can watch, and it's got the same documents only geared for the Dehabilitation or Employment Service Provider Agency. So let's see, please continue to reach out. We have a designated mailbox, MoDD HRST Project, and I'll make sure that gets dropped in chat, but it's MoDD HRST Project at dmh.mo.gov. Don't hesitate to reach out. Let us know if you're interested, and we will work with you on going through the steps to get implemented with the HRST process. Statewide implementation will be May of 2023, but you can definitely start now and get going with this new system. So let's see, my next topic. Sorry, I feel like I'm kind of going fast. I'm going to show my screen here. This email blast came out the other day, and on Tuesday, October 25th, I am honored to join Lisa Nothouse with a MoDD&U. It's a Lunch and Learn webinar, and we will be talking about the Health Risk Screen Tool, or HRST, and it's for individuals and families, and we'll talk about what that looks like for individuals and families, and anyone can join. Any interested stakeholders or individuals, please do join and we can talk and answer questions and share some information and things of that nature. So this link will drop in chat. This is to that web blast. And then what you do is you just go down there where it says click to register, and you can register for it, and it'll pop up and you can join it virtually. So hope to see you there. See another webinar blast that came out. We had our 2022 annual RN Oversight webinar on September 29th. And we appreciate all of those who are able to watch, but we understand you can't always, join at the time. We do have on the division's education webpage, there's a link right there where you can go ahead and go into our Relias learning platform and watch that, and you will get a certificate. And I just want to say, those of you who were able to watch the original, we will be sending out certificates to you. I apologize that it's taken a little bit, but we'll get those to you, so don't fret. So anyway, we'll drop this link in chat. It takes you to that email blast, so you can go in and get going with watching that if you choose to. And I'm going to show a final web page. And just wanted to let you know, the Missouri Department of Health and Senior Services, they sent out messaging to encourage Missourians to get a flu shot and a COVID-19 vaccine or booster if eligible, and if you're able to. The messaging states that there have already been flu-related cases across Missouri this month. They're encouraging to get a flu shot to protect yourselves and loved ones against the flu, especially those who are considered high risk for serious complications. So those who are considered high risk per their messaging, young children can really be affected by the flu, adults 65 years and older, pregnant individuals, children with underlying medical conditions, and individuals with the following conditions: asthma, heart disease or stroke, diabetes, HIV or AIDS, and or cancer. And also just letting you know, when you go to get vaccinated, they can do both the flu vaccine and COVID vaccine at the same visit. So you don't have to make multiple trips if you're comfortable with that. That's really all I had for today. Reach out if you guys ever need anything. Don't hesitate to reach out to the MoDD HRST project at dmh.mo.gov for any HRST related items. And you all have a great day and a great weekend. And I appreciate being able to be on here this morning.
Thanks so much, Leslie. I do want to let folks know we did put a lot of links in the chat today. We mentioned several email addresses. I think most folks are familiar with our main inbox, which is ddmail@dmh.mo.gov. If in doubt and you say, you know what, I don't remember what they told me where I was supposed to send this, you can default to that ddmail@dmh.mo.gov, and we'll make sure we get that, get the address to the right person or the right program area. So also, if there's something that wasn't brought up today that you're like, oh gosh, I really thought you were going to talk about this, or I need more information about it, you can also send an email to that ddmail email address as well. So that is all that we have today. So thank you everyone for joining us. We had over 200 folks on the call today, and hopefully everyone enjoys those 80-degree temperatures this weekend. Thanks.